The Press 3 option for the suicide prevention lifeline will no longer be available. That is the option for LGBTQ plus focused support when you call 988. Earlier this month, the Substance Abuse and Mental Health Services Administration announced they would, quote, no longer silo LGB plus youth services through 988 starting July 17th. 11 News reporter Aaron Vitito is in studio with more on this. This is one of a few tailored options offered through 988. Aaron.
And federal officials say they're stopping this specialized option in favor of focusing on all help seekers. But it's worth noting that there are other options that are set to continue. These include dialing 1 for veterans, 2 for Spanish speakers, and dialing 4 for Native Americans. That's in the state of Washington. Some local care providers here in southern Colorado say they're disappointed, but want you to know there's still help available for the LGBTQ plus community.
My life has been saved by having these resources.
Ollie Glessner works with Inside Out Youth Services, an organization that has been providing specialized care for LGBTQ plus youth in the Pikes Peak region for decades.
When we approach mental health with a one-size-fits-all mentality, we lose people all the time.
They say their services have become a necessary fixture in Colorado Springs.
We have young people who come to Inside Out Youth Services, and most of the people who we enroll have said that they have attempted suicide before. 60%. That is a huge number.
Nationwide, the National Library of Medicine reports 65% of people studied who identify as gay, lesbian, or bisexual report behaviors of self-harm. 73% report suicidal ideation, and 25% say they have actually attempted suicide. And transgender people reported higher numbers, with 82% reporting suicidal ideation and 40% saying they've attempted it. The American Journal of Psychiatry says people in the LGBTQ plus community are more than twice as likely to self-harm than heterosexual and cisgender people.
Historically, I don't think we have served the community as best we could.
That's why Katie Blickendorfer with Diversus Health says despite these cuts at a federal level, they are still dedicated to serving the LGBTQ plus community the best they can.
There's still resources, particularly in this community, for people to access.
And she says that's the message she wants to get across to southern Colorado, that despite these cuts, there are local, specialized resources available.
Last year, I think we served about 10% of our population was part of the queer community. And so we pride ourselves on being a competent provider with the queer community and want to continue to be so. Our resources still exist, and they're going to keep existing, and there is absolutely nothing that will stop them from existing. When we get to be who we are, transgender or not, when we get to be who we are, our authentic selves, our mental health improves.
If you or a loved one needs help, 988 will still be available for everyone. And Blickendorfer says it is staffed with people on a local and state level who can still direct you to specialized resources locally. You can also visit Inside Out Youth Services or Prism Community Collective for help for adults. You can also call the Trevor Project at the number on your screen and the Trans Lifeline for transgender-specific help. And I put a list for all those resources on our website under the Find It tab. And we've been highlighting LGBTQ plus focused stories all month long. To find them, you can head to our Roku app over here. Look for the Pride Month playlist. You'll find it under previous newscasts right here. Pride Month, you can see all the previous stories we've done. And this one's going to be up there in just a little bit. Adam.
All right, Aaron, thank you. Well,